Thank you. Okay, good afternoon. So we have, we're going to begin now with can you all listen? Can you all hear? Okay. We'll begin with the second panel, which is on subjective well-being and potential uses and examples. Okay, it's 1:15 right now. We have 2 hours left, and I think that would mean that we would have lunch at 3:15, but due to the busy day we've had today, I'd ask panelists to try and reduce their intervention maybe to 15 minutes if possible. This is a panel which will discuss the issue of how we actually use information. In this morning's presentation, Professor Diener, when he mentioned the Wellbeing for Public Policy book, he mentioned a few examples of public policy, and I remembered one. However, afterwards, Benjamin Tamkin said we should avoid intuition when it comes to public policy and base ourselves on hard data. But I'm going to give this example anyway, because I think this example responds to subjective well-being through intuition. It's a recent example being developed in the city of Aguascalientes. For those of you who live in this country, well, you know that the mayor who's been there for two years, she's a woman, and she's decided in the west part of the city and on some very highly urbanized area. It's poor and it had no parks. They created the Green Line, something called the Green Line. It runs from north to south on this western part of the city, and the purpose is basically to bring some greenery and provide well-being to the population of this part of the city. But well, this was more intuitive. We don't have any data for Aguascalientes or any other city in Mexico, but the potential in terms of public policy for all these examples are there. So without further ado, I will pass the floor to our speakers, who I will introduce. Well, first we have Edgar Ramirez from Cedesol, then Zachary Kurser from the Gatsum Institute, then we have Pablo Gonzalez from the UNDP Chile, and Sabelio Gasteloni from ISTAT, the Italian Institute for Statistics, and finally Mariano Rojas from Flaxo. So we will begin with Edgar. So we're going to read some of his bio. Well, he's currently the General Director for Analysis and Prospection of Cedesol. He has dedicated himself to research and public policy analysis. He's experienced in poverty, income distribution, and regional development. He's a co-worker. He's my co-worker on the technical committee working with the Millennium Development Goals, and well, he might speak of this subject as well. He teaches economics at the ITAM, and he has a PhD in economics from the University of Essex, where he also studied his master's in international economics, and he studied first at the ITAM. Good afternoon. On behalf of Undersecretary Juan Carlos As Key City, I'd like to thank the organizers and particularly Dr. Sojo for his invitation to participate in this panel. The purpose of my presentation is to underscore the importance of the new indicators and this measurement of subjective well-being in public policy as developed by this Mexican state. I will use the definition of well-being and afterwards I will describe some indicators for objective and subjective measurement of well-being. I will also underscore the status quo with regards to the use of subjective well-being indicators in Mexico, and I will, before speaking of the subjective well-being indicators, I wish to mention some of the indicators which we currently have and which are the basis for public policy in Mexico. We will mark some reasons why we should indicate why we should include these, and also within the Sede Sol in order to reflect on this experience and speak of some possible methodologies and also of our methodologies, which are of course perfectible. And after that, I will reach my conclusions. What do we understand as well-being? Well, although this concept has been traditionally dominated by the variables related to income or access to material goods that provide this well-being. In recent decades, particularly in the late 80s and early 90s, we have begun incorporating as part of well-being measurement other dimensions that go beyond income. In this sense, we have that the incorporation of other things that have to do with population's well-being, or things that matter to people and which allow them to do things or be something. We know that today we can divide methodologies or objective indicators. Today, the word objective is quoted between quotations because all variables we use for measuring well-being are all approximations to what provides satisfaction to a person. But there are variables which are objective or verifiable or concrete, and we also have new indicators for subjective measurement for well-being. Objective indicators serve for qualitative or imputable variables. Normally, they concentrate on measuring consumption, income, or the possession of assets or goods in the family. These indicators are in a way related to traditions in which specialists determine what factors will enrich the life of persons or allow them access to a fulfilling life. On the other hand, subjective researchers study satisfaction or degree of happiness of people, or the happiness they derive from either consumption or access to things that provide satisfaction. In this sense, we can say that indicators for subjective well-being will allow us to go one step beyond the first things mentioned, because once we analyze the access to these satisfiers, it is the individual who reports a level of satisfaction or well-being through his own scale. He will say what matter most to him or her. When we speak of the situation in the national context and the measuring of well-being from social development perspective, we see that most public policy towards development focus on indicators that seek to objectively measure well-being, considering things such as lack of resources, lack of education, precarious housing, and other type of material issues. And these refer to a minimum well-being condition. So we've defined, in terms of social rights, what the Mexican states offer people. And in this sense, we agree with Amartya Sen. There's a non-reductible issue in terms of what provides, of what the state must provide. And this sounds like an imposition, but from a tradition of presumption, it is these goods that allow people access to a fulfilling life. And this is what poverty measurement has focused on. These are mostly accepted. The methodologies are relatively easy to measure. And we also have in the collective mind, well, we've accepted these, and most people will not negate access to services, to education, to quality of a house or food as basic needs, and also access to social security. And these are some of the variables incorporated in new measurement of multidimensional poverty. Currently, some of the most used indicators within the Cedesol in developing a social policy are focusing on attention on vulnerable groups, or for diagnosis on particular problems which form part of our ministry's work. Includes indicators such as poverty and income, marginalization, the MDOs, low weight, marginalization, and other social issues that can be incorporated in a global understanding of poverty. So why would we need to have more indicators when many of these indicators are complementary or secondary and therefore serve as substitute for some variables? Well, the question is, why do we need more indicators? Well, the answer is that despite the fact that all these indicators are studied with the purpose of following up on people's well-being and in order to attempt to improve the lives of people, we never ask the beneficiaries of social programs or citizens in general what their satisfaction level or what the satisfaction they derive is from this. If these are really the things that social policy should give attention to. And in this sense, and considering the subjective well-being indicators as a useful tool to understand the needs of the people and also the degree of satisfaction that these people derive from the services provided by social programs, we've tried to include these measurements. And one of them is to incorporate the lack of access to food to the multi-dimensional study of poverty with the help of Conmeval, and also the incorporation of other information on people who benefit from social programs in order to benefit the operation of these social programs. As you knew, the old measurement of poverty was based on the Ulteso model. Recently, this This was changed as of 2000. Well, we have measurements from 2011, but the announcement was done in 2009, where aside from income, we were considering other dimensions. These are 6 social problems as well as income. Well, this represents a great step forward because well-being of people goes beyond income and also includes life conditions. Now I will speak of lack of access to food and how this relates to how we measure subjective well-being. Well, basically, through a perception issue, we have a 12-question battery in which we identify situations in the last quarter of the survey, and we relate this to lack of money for in individuals for access to food. And as a result of this battery, we built a food scale in which we have four levels of food safety. We have light, moderate, and severe. Both moderate and severe. All the people who are in these categories are the people who we can identify as people who have problems with access to food. As an example of this, I want to mention some of the questions we're asking in terms of, well, one of them is, have you or any adult in your family stopped having, did you skip breakfast, lunch, or dinner? Did you ever eat less than you should? Did you ever run out of food? Has any adult felt hunger and not eaten? Has anyone any adult here skipped food for an entire day? Well, this not only includes food sufficiency, but also variety. The other 6 correspond to households where we have children, and they are similar questions. When we see the results of this battery, well, of this survey, what we have at the national level, we have 28 million Mexicans who were in these situations through the perception issue, lack of access to food, and this is 24.9% of the population. And some of the findings that are interesting are that, with the exception of Guerrero, Chiapas, and Oaxaca, which are the poorest states in the country, well, except Guerrero, all states, they're not the ones that show highest lack of access to food. So there's an issue also of perception of what people can do in order to face food shortages and with their income. Well, with further analysis shows that there's an inconsistency in the sense that we can find people who, from the 7th to the 10th percentage of income, people who have sufficient access to pay for basic food items or staples, they say they have access to food. Out of these 28 million people who say they have access to proper food, there are 18 million who are above their, who have income above the well-being line, and 7.6 million who are above the minimum well-being line, which is the threshold through which we determine extreme poverty in terms of income, only considering income. So we need to consider subjective measurement. Your income is usually underreported, but even considering the fact that we have underreporting of income, we don't understand why there's such a difference in the measurements. despite this inconsistency or in the face of it, we think we need to find a compromise between objective measures and subjective indicators. And we think that we need complementary and not competitive measurement indicators, and that's why it's important to take this into account, to know what people's perceptions are. We have a clear example of how this combination of subjective and objective measurements are, and an example is the National Crusade Against Hunger, in which subjective issues were considered, but also in terms of when we have scarce resources, it's important for governments to define what their priorities are. Okay, who are the people who can't satisfy these needs? Okay, well, in terms of income, we know that within the extreme poverty percentage, which is about 11% of Mexicans, there's about 7 million who say they do not have access to food. It would be very important. We would require an analysis. What happens with 4 million extreme poor, 4 million people who are in extreme poverty, who, despite the fact they don't have sufficient income for staples, they say they do have access to food. So what's happening? It would be important to understand this situation. Another important example is the incorporation of perception surveys, in which we try and understand the satisfaction of people who benefit from social programs. These surveys try and compromise different elements. For instance, we have the development program for priority areas, where we installed hard surface floors, and we asked about how this improved their lives, their family life, the quality of the floor, and other things. So this subjective idea of well-being allows us to understand how much people are actually feel benefited from these issues. We also do these surveys for programs where we provide milk to people, and that this way we ensure that these evaluations are considered. Other examples of incorporations for subjective well-being has to do with subjective well-being measurement networks. For instance, within the unique socio-economic models, we take social cohesion into account, and we identify if this network exists by asking a question like, how hard would it be for you to obtain help or cooperation from your neighbors? We should also surveys on use of time, on how the use of time derives information on people's well-being. Also, because of time now and out of respect for the rest of the speakers, I will limit myself to the following reflections and conclusions. Well, we see that subjective well-being measurements are a useful tool to know and to learn about people's needs, and also to learn about satisfaction with regards to social programs. However, the detection of needs can be subject to biases, which would require a better understanding of subjective well-being. When describing priorities, we need measures that do not distort our variables or over-reporting or under-reporting that differ from other observed variables. The objective understanding of well-being increases with the development of the country. Well, Amartya Sen accepts the importance of happiness, but she thinks that there are things that should come first, like justice, liberty, and human rights. Mexico's public policy focuses on trying to provide to social rights of citizens, and by providing certain rights in terms of health, education, housing, and other issues. Finally, I'd like to say that there's a great window of opportunity to strengthen measurement schemes by considering objective and subjective measures as complementary and not so much competing. Thank you. Thank you, Edgar. And sorry for the pressure, but they've asked us to be strict with time. Okay, our second presentation is on users of the subjective well-being statistics in the UK, and this presentation will be by Zachary Kosser. He is a senior program director and fellow, and at the Legatum Institute, where he is responsible of implementation and management of publications. He has also researched and written about democratic theory, participation, political parties, and electoral politics. Zachary has published articles on the link between political parties and democratic participation. He has a master's degree in governance from the University of Virginia, and also a PhD from the same school. He studied at Claremont McKenna College. And I pass the floor to Zachary.
All right, thanks very much. If I seem a little tired, it's because I just got off a plane from London, but I have to say it's an absolute pleasure to be here. I want to say my thanks to Inegi and Flaxo for inviting me, and just what a revelation this lovely weather is compared to dreary London. It's a hazard of going later in the program, both that I have to shorten my comments and that some of what I will say will seem repetitive. But I would like to think that what little I say that is repetitive is what a social scientist might call convergent validity, that we are all working together towards a common goal, and I think that we're discovering some common findings about subjective well-being. So I'm here to talk about three things. First of all, I'm here to talk about the Legatum Institute and why we are involved in well-being studies and why we're involved with the government in the UK on this subject, and why we're interested in well-being. I want to talk about the Legatum Institute Commission on Well-Being Policy, which was inaugurated in November of last year. We just had our second meeting this April, and I'd like to talk about some of our preliminary thoughts about providing guidance to governments about how they can use subjective well-being for policymaking. And lastly, I'd like to give a brief overview on the current state of subjective well-being and the use of it within the government there. So first, to Legatum. Why are we involved in this? Well, Legatum is an independent, nonpartisan policy organization, and we have a research agenda that's focused on advancing ideas and policies that support free and prosperous societies around the world. One of our major research initiatives is the Legatum Prosperity Index. I've brought some copies of this. Most of them have been taken. I have some more that I'll bring tomorrow or have someone bring by tomorrow. But I would encourage you to go to our website, li.com. We have not only this, but a wealth of web resources with which you can parse our data and get some ideas about how we define prosperity. So our Prosperity Index looks at or operationalizes, if you will, the idea of prosperity into 8 component parts or 8 sub-indices, each of which are equally weighted. You can see we have economy, entrepreneurship and opportunity, governance, education, health, safety and security, personal freedom, and social capital. We think that all of these things combine to give a picture of the prosperity of a society. We do this because we believe that, typical measures, material measures of success, GDP, do not give a broad enough or capacious enough picture of the flourishing of a society. We think that one must go deeper into, for instance, the community. What sort of social capital connections are there? How much personal freedom does one person have? What value does education have beyond the sort of instrumental use of it to increase one's income over a lifetime? We think these things are captured better with a deeper understanding that goes beyond material measures. I won't go into the methodology of creating the Prosperity Index, but I will say that one part of the Prosperity Index is the idea that if we combine measures of wealth and well-being, we can get a snapshot of global prosperity. We're in our 6th year now. We assessed 142 different countries. It represents more than 96% of the world's population and 99% of the world's GDP. It provides a conceptual framework for understanding prosperity, and we rely on well-being data to compute scores and rankings. This places us squarely in the beyond GDP discussion, and that's one of our interests in looking into how well-being data can be used in policymaking. We want to consider how different social and economic factors measured using both objective and subjective measures can impact income and well-being. Just to tantalize you with the rankings, here's the global rankings of prosperity, green being the ones that rank nearest to the top, red being those who rank towards the bottom, gray being countries for various reasons, we can't yet cover. The countries that come out at the top of the Prosperity Index are the Nordic countries. They tend to, from time to, in most of these indices, it seems that Nordic countries come towards the top. We can have a discussion of that, not really appropriate for here. 2 key findings I want to talk about that I think will illustrate some of the interest in well-being. We find that in creating this Prosperity Index, the key drivers of prosperity are accountable governance and entrepreneurship. And it's particularly true for the top 50 countries. Whereas developing countries, health and education play a more crucial role, the index finds that good governance and entrepreneurship tend to go together and reinforce each other, generating a virtuous cycle that leads to greater prosperity. And a key stepping stone to prosperity is, as I said, accountable government. I don't think it's a coincidence that 27 out of the 30 countries in the index, the top 30 countries, are democracies. I won't go into this, but if you take a look at the Prosperity Index or go online, this is our ranking of Latin America, just for your interest. So let's transition into talking about the Legatum Institute Commission on Wellbeing Policy. Lord Gus O'Donnell is the former head of the British Civil Service, and he has had an interest in well-being and well-being policy while he was in government, and particularly while he's out of government. And he approached our institute because he thought we could serve a unique role. And that is to say that we could be an objective, nonpartisan look at well-being policy without having the constraints or influences of having to work within a government. The idea being that the conclusions that we draw would be independent, useful, and hopefully generalizable to a global audience and not just the UK. But nonetheless, the UK government, the Cabinet Office, and the Prime Minister are all very interested in the conclusions of our report that I'll talk about in a minute. So members of our commission, we have Professor Angus Deaton from Princeton University, Martine Durand from the Chief Statistician from the OECD. We have David Halpern, who's our closest connection, I think, with government. He is the head of the Institute for Government in London, and he also heads the Behavioral Insights team, which is the the body that works on these questions of well-being, most particularly for the Prime Minister's office. And then we also have Lord Richard Layard from the London School of Economics, who's done a great deal of work in happiness. So what is our goal for the Legatum Institute Commission on Wellbeing Policy? Well, the first is to examine how subjective well-being may help expand beyond GDP and the standard model of homo economicus, the idea that we are all simply calculators of utility and that we all simply make rational judgments about goods and services. We want to improve the measure of people's behavior and what motivates them in order to improve governance and to also improve citizen well-being. And with our report, we want to offer guidance on how to apply subjective well-being analysis to policy-making decisions with general applicability, i.e. global relevance, not just with the UK. But as I said, obviously we're based in London and we have a lot of interest from the Cabinet Office, so we are looking at the UK as well. We will be producing a report in early 2014 that will examine these questions and offer some guidelines. But I have some preliminary notion of what we're attempting, which I can talk about. Each of our commissioners has decided to take on a particular theme. I'll just briefly talk about how we're thinking about well-being. I know we've got a short amount of time. Maybe it's probably best if I'm actually very curious about getting feedback on this, that maybe afterwards during lunch, interested parties can come talk to me about this. I'd like your input. But we have a chapter, a theoretical analysis by Professor Deaton, a look at subjective well-being data by Martine Durand, a policy case study being done by Halpern and Layard, and then a cost-benefit or a cost-well-being analysis, which I'll talk about in a minute. First on theory. I think it's really exciting, well-being research, because I think it's, psychology and behavioral economics is putting real pressure on the standard model of economics. There are a range of circumstances in which the standard model does not describe the way that people actually behave. Subjective well-being opens up possibilities for enlarging this model. And I think it's important to note, although I think it's been noted earlier, subjective well-being is simply not a measurement of hedonic experience, that is to say how euphoric or depressed one is from moment to moment, but thinking about it in terms of life evaluation and how people can best live. I think if you look at life evaluations, it's more stable over time. I think you find that it peaks in midlife, and also, as has been said, it does not saturate with income. One idea that has been floated by Professor Deaton is one potential way of using subjective well-being measurement is simply to reduce misery. And that is to say, I think it's a very easy way to apply in a useful policy means of trying to measure how you can reduce people's misery. So you can have an objective measure, has this policy actually impacted or reduced in some way how onerous day-to-day life is for citizens, whether it be shortening commutes, whether it be adding those green spaces, whether it be reducing airport noise, all these ideas that are floated about how we can use well-being policy. Why not look at it in the way of, have we actually reduced misery as a way of measuring progress? So what does subjective well-being pick up that the standard model does not? Well, obviously this has been well covered today, but I think it's useful to reiterate these things. It's more sensitive to a wider range of experience, and it has a wider applicability to things that people care about. As has been shown, subjective well-being is higher among those who are engaged with family, friends, and are married or cohabitating. It's lower among the divorced, the widowed, or the separated. It is sensitive to where people live, and it picks up negative amenities like aircraft noise and pollution. I think that should give us some indications of what policy areas would be most applicable or useful for using well-being data. Under a subjective well-being analysis, education, for example, I should say this first, again, in sort of opening up or broadening our view of human behavior and how we value things and what we care about, if you take a subjective well-being analysis on education, for example, I know the debate in the United States about higher education right now is very much on the question of value. You know, what are we getting for our money out of education? But by looking at a subjective well-being analysis of education, we can look at education as being something more than simply something instrumental in generating income, that it has other qualities that can lead to general life satisfaction. Another thing that you could look at is unemployment. Unemployment is more disliked than would be indicated by its instrumental role in producing income. There's obviously things about having a job that go beyond simply earning a wage. You know, self-worth, a person's place in the community, the values, the solidarity values of being in a workplace, all these sorts of things would not simply be indicated by a kind of rational analysis of income. I want to point out some concerns about the use of well-being data, or some pitfalls, maybe even some dangers that I haven't heard yet today. One is that an interpretation of the limited rationality of individuals, that is to say, if we go beyond thinking about just utility and people as rational maximizers of utility, and we look at the messiness that actually is living our lives, we find that oftentimes we are very limited in our understanding of our own well-being, or what makes us happy. We make choices or trade-offs that are not stable over time or don't necessarily adduce to our overall happiness. You don't get that kind of analysis under simple utility analysis, and it opens up the possibility or maybe even the encouragement for a kind of paternalistic intervention by the state. Many of you are probably very familiar with the Thaler and Sunstein book, Nudge. This idea that tries to create a soft paternalism and avoid the coercive dangers of paternalism that this framework could produce by having governments offer citizens organized choices and giving them cues about what will lead them to be happy. But there are other voices out there. I would point you to Sarah Conley's recent book, Against Autonomy, Justifying Coercive Paternalism. She clearly goes beyond the sunny optimism of Sunstein to place government squarely in the role of making choices on the behalf of their citizens as they define what's best for their welfare. And I think that's a dangerous potential danger for well-being policy. If government straying too far into thinking not necessarily what makes people happy, but trying to determine their life choices and getting them to those goals. Okay, I'm running out of time. I want to talk a little bit about Richard Layard's work and how it can tell us about effective areas or useful areas for using subjective well-being data and thinking about it in the long term. That is to say, what is it that makes us happy overall during the course of our life? I'm guessing you're probably familiar with the British cohort study from 1970 that is fairly unique and looks at a group of children that were born the same week in April 1970, and it follows them over the course of their life. And Richard Layard has looked at this data to try to draw out what is it that makes people feel most satisfied with their life at various stages of their life. And just looking at explanation by variables in adulthood, these are beta coefficients, things that are most correlated with life satisfaction at 34 years of age, the one that stands out is full-time work at age 34. Earnings comes in at 0.12, married or cohabitating 0.1, but it's also interesting to see emotional health, and this is an interest and focus of Richard's. If we move back and start thinking about children and childhood, and thinking about how this can inform policy about family policies, laws, these sorts of ideas. What's interesting is that one's emotional development at an early age has a profound effect on their happiness later in life. Emotional health at 5, 10, and 16 is most highly correlated with life satisfaction at 34 years of age. An interesting finding. All right, I'm pretty much out of time here. And I was going to go through, maybe if you just give me 2 minutes, I'll race through what the UK is doing right now acá. Uno minuto. Prime Minister David Cameron has made a commitment publicly to the importance of using well-being in making, as he says, government decisions on policy and spending in a balanced way that takes into account what really matters. And the Cabinet Office has worked to include subjective well-being questions in a variety of different areas of government. Probably the most impactful has been the 4 questions that have been added to the largest survey that the Office of National Statistics does, the Integrated Household Survey. They've included 4 questions since 2011. It's a 120,000 person sample. Their first report was released in November 2012. I recommend that you take a look at that if you're interested in learning more. The questions, there's 4 questions. They cover evaluative, eudaimonic, or simply how happy you are, and hedonic well-being. And includes these in their National Household Survey. There's also been subjective well-being questions added to a number of different surveys that are done throughout government. This is just a list of ones that have been included. One of the departments I think that has most responded in a way to well-being has been to the Department of Health. I would recommend that you take a look at their public health white paper to get an idea of how they conceive of well-being and how it can improve their policymaking. There was a pilot program done on national citizen service, basically a summer program for 16-year-olds. Does this increase their life satisfaction by participating in it compared to a control group? In a survey, the answer was found that yes, indeed, it does. At this point, I'd have to say, though, it's very early days for the use of well-being policy. And I think it's going to be a challenge for statisticians and for policymakers to try to implement this within bureaucracies. Because I think one of the challenges that the Cabinet Office is facing is getting buy-in. That is to say, demonstrating to various departments, how is it that my use of subjective well-being data is going to improve the way that I do my job, and is going to improve the life and welfare of the citizens that I serve. So I don't have a ready solution to that at the moment. I just have to say that I think there's a lot of promise here, and I think we're still in early days. Thank you very much for inviting me.